mandates, most of the activities implemented, including their focus on the protection and delivery services to the most vulnerable groups, which include persons with disabilities. Since the enactment of the bill of the Act in 2021, my ministry has taken steps to establish the disability fund. First of all, we established the disability fund in the year, and with the allocation of $4 million. The ministry has implemented the following activities: rehabilitation work at the National Rehabilitation Center in Banjul, and the state-of-the-art equipment for service provision to people with disabilities. The building was dilapidating. That's the orthopedic unit in Banjul. So we did a complete renovation. I can say we did a 360 renovation and made sure that the office is up to standard. And we didn't do that, but we also provided equipment for the manufacture of limbs. Here in the Gambia, we have a lot of people now asking for it, and something being, people are now suffering from diabetes, and many times they are amputated. And also because of accidents, many people are now being amputated, and they need the limbs to be able to function effectively. And as a result, it has resulted us doing manufacturing more limbs, buying materials, and also manufacturing more limbs for those people to be able to move about as comfortable as anybody else. It also required, it's in the state-of-the-art equipment to be able to do that. So we bought the equipment and did a further training of our staff. 2 years ago, we trained 22 staff with support from trainers from Switzerland. Yeah, Swiss, yes, exactly. And then 22 people were trained. Only 11 were from the physiotherapy unit of the Ministry of Hospital. And the remaining 11 are our staff. And I think we also take some other staff from Guinea-Bissau and Sierra Leone. They also join us. Yeah. And more trainers also join us from Guinea-Bissau as well as Sierra Leone to do the training of 2022 on the manufacturing of the limbs. We provided following the training, we are able to provide rehabilitation services to 500 people on orthopedic and medical services, such as the wheelchairs, the crutches, the Zima frames, and also the white kids. And we also required and supported some of the wheelchairs which were broken and brought to us for servicing. And others essentially such as crutches, 2,220 people with disabilities, leading to 5,700 people with disabilities. So altogether, we will support 5,700 people with equipment, wheelchairs, crutches, and Zimmer frames, as well as white canes. These are all people with disabilities. We supported the Government Foundation for the Disabled and the Disability Advisory Council, and 19 external organizations with disabilities with the consideration to enhance the implementation of their programs and activities. 10 of the organizations are already identified and supported financially. We supported the Educational Welfare Community Units Activation Program of outreach services. So we don't only provide services here in Banjul, but we also provide services across the country. Regional training of people with disabilities within the Banjul area, and we are able to train 50 people at the level of TVET. We strengthen support to 6 special needs education schools and other schools according to special needs students. All those schools that accommodate students with special needs, we are able to support at least 6 of them across the country. And we are purchasing laptops with installed JAWS softwares to be stationed at the library, at the UTG. This because people with disability, like those who those who are physically impaired, we have to support them with laptops. These are talking laptops, so that they can be able to do their work as any other students. We've learned that there are very number of students who are visually impaired, and they need support in that area. We wrote to the UTG, and they were able to give us the information that yes, they need the support. So we are preparing the laptops, and we still place them at the library, because we can't afford to buy one for each individual, and because it's not sustainable. But then we place them in the library so that these students can also do their homework and their other assignments using those laptops. And not only that, but we also intend to do the same for Gambia GTTI and also Gambia College, as well as the Marine Development Institute. And this is something that we want to continue doing every year. We can't buy enough for all the institutions, but we try to do it every year so that at least in 5 years we'll be able to get quite a number for each of the libraries in this institution that I just mentioned. If you look at the policy activity plan for people with disabilities for 2023 to 2026, this will guide the implementation of the activities that we have in place. Engagement with OPDs on the CIDAO, the CRPD, and Disability Act guidelines, in which participants that were targeted per region. Every region, we were able to bring together 60 participants and we sensitize them on the CIDAO, the CRPD, and the Disability Act guidelines as part of the popular implementation of these implements, these documents. Quarterly meetings of the National Executive Committee for People with Disabilities, Q1 and Q2 were also held. One important thing we did is to organize the make sure that we have a National Disability Advisory Council in place. And then we also did inauguration. There wasn't any before, but as part of the implementation of the Act, we also presented the committee and also did inauguration 3 years ago. This was funded by UNFPA. And we do organize quarterly meetings of this advisory committee, which we fund at all levels. Under the Family Centering Program, the ministry is providing monthly cash transfers of $1,000 per month to 505 people with disabilities in all the regions. This was region 220, URR 102, NBD 110, CRR 20, CRR South 20, CRR North 17, and LRR 35. This was the pilot phase in which we provided them with $1,000 per month. We know it's a small amount, but it was a pilot. And based on lessons learned from this time on, now we're giving more money, that is $2,000 per month of cash transfer to these people. And we were able to get the numbers from the special register. The survey was collected by GBOS. And then from that report, we were able to extract the figures. And we didn't only go ahead to do the transfer, but we did the validation around the communities to see whether they really exist before we started making the cash transfers. Ratification of the African Charter on Human People's Rights in the rights of persons with disabilities in Africa. This document was certified. It was certified before, and now we have certified the document. And that of the elderly to the AU Committee of People with Disabilities and Elderly in Addis Ababa, Ethiopia. After the certification, I think it came in the National Assembly. Yes. Before we fought almost submission to the AU in Addis Ababa. So we, two of them, the one on the people with disabilities and the one on the elderly, and they all passed through the National Assembly before almost submission to African Union office in Addis Ababa. And we demonstrated certificates of ratification of the AU protocols in the rights of persons with disabilities. Through our partnership with Lex for Africa, stands supporting us with 20-footer container with sensitive devices such as wheelchairs, 45 crutches, 75 rollators, and next step, that is this year, we are planning to roll out our rehabilitation center for persons with disabilities to Bansang, CR, and the hospital. With Lex for Africa, we are planning to have a regional training center here in Gambia. And because they are here 3 years ago and they came again this year. And they were impressed by the work that we are doing. And that's why we have started the Gambia to serve as a regional training center for the manufacturing of limbs. So I think we in the Gambia are fortunate to have that. And we are waiting for them to come back. A mission was sent, and consultancy, and there's report teaching. And that's one of the recommendations. So they've gone back, and we're hopeful that before the end of the year, work is going to start. on setting up the regional center for the training of and training of individuals to manufacture leaves who had, especially those who are amputated. I think this is what we have for now regarding the implementation of the Act since it was passed in 2021. And one important thing is that the rehabilitation is not something only here in Banjul. We move around the country. And we are planning also to have a mobile clinic in which we can move from one region to the other and do the rehabilitation before we are able to build a structure. It's very expensive to build a structure. We don't have funding. We are hoping that very soon we start the mobile clinic. We can move from one region to the other, providing the services as appropriate, so that everybody doesn't have to come to Banjul if they need services. But we can teach them in their communities and provide the necessary services. In short, this is what we have been doing. Most of the funding is coming from government, and it's only a few philanthropists who also give support. But I can say 90% of the funding is coming from government. Thank you so much.
Thank you so much, Honorable Minister. I think you have gone a long way. Even though there's still a lot to be done, but we applaud and appreciate the efforts, especially in the direct support, because all the support that you are giving is directly impacting these people with disability, and I think that is what we need to do. But also we need to ensure that they are also independent, not just relying, like you've just mentioned, it's only government that is doing everything, and government can be exhaustive sometimes as well. They have other priorities. We really appreciate especially the monthly allowances, the monthly transfers, because most of them, without that, maybe they might not even eat. And I think it's a good initiative from the government, and also having the limbs manufacturer. I think we should follow up on that to ensure that that does not only give them the opportunity to have them cheap, but also give employment to Gambians as well. But what I'm also particularly concerned about is the implementation, the adherence to the law, not only by the government, because you have done your part. You have come up with an act, and the local government also have a part to play, because they should also make sure that their authorities safeguard persons with disability and also have a duty to report on infringements of the rights. For example, it is part of the law, but also education for persons with disability. I personally had complaints from the GOVI because they said that their system only ends at primary grade 6, and if they go beyond grade 6, they have to go through the normal conventional schools, and sometimes it deters them from continuing their education. We would want to know what the government will also do on that. And also, you've mentioned the computers that you buy in institutions, which I think is a good initiative. Of course, we cannot buy for every person, but if there's a center that they can go to, does these computers come in Braille, or because if they are visually impaired, they might need to use Braille, or sometimes computers now, maybe they might not need Braille because they are technology, they are computers that dictate what you do. I think we also need to factor that as well. And also access to buildings. Access to building is very important in this matter, because if they cannot access, even if they are employed, they might not be able to go. So I think that adherence is also very important. How is the ministry monitoring that these things are adhered to? Because that is also very important. I would have to give the floor to my colleagues. Maybe also they obviously have things to, matters to address in this, but I would want us to go through the bill to make sure that adherence in every part of the bill is done, and how the ministry does that, and also the data collection. Honorable.
Thank you so much, Madam. What I have here is like a question sort of, because I can say since the passing of the bill 2021, we've been seeing a lot of disabilities begging outside the country. Everywhere you go, you see beggars around. And as you alluded here, you say you've been giving support to them, which is $1,000. And I think that 1,000 is not covering all the disabilities in the country. It's few. Now it has increased to $2,000. But it looks like the Act 2021 is moving slowly because we've been seeing a lot of beggars outside. What can you do to reduce that kind of problems in the country? Because beggars are too much everywhere. And the second thing, what I want to ask is about tentatively the ministry is only supporting disabilities at the UTG. What about disabilities at the upper basics and those who are not even learning? What is the ministry doing?
No.
I think you've almost said everything, so just to applaud the ministry because it's a baby ministry and it's just a new ministry, and then when we look at their activities and their engagement, definitely they are definitely on track, and the only thing like that we talk about in terms of accessibility to buildings and giving equal opportunities within the ministry. So I don't know whether the bill would address that. Because like if you work at every, especially government institution, we should be able to identify them. So if we are talking about it and we are not seeing them at workplaces, I don't think we are moving. So this is something that should come within the bill so that we have them at workplaces. Definitely they are doing great, but I know your constituency should look at your budget again. But I think you are doing fine.
And one more thing about the establishment of the, I'm just adding one more thing about the establishment of the function of the advisory council for persons with disability. We also need confirmation whether that has been established as well. So we give the floor so you can.
Establishment
of the council, advisory council.
Yeah. I mentioned that.
Okay.
I said that it was established in November 2022.
Okay.
And with funding from UNFPA, and then they develop their annual work plans, and then we give them support to implement their activities. The activities across the country. And I think
We need to
see
them. We need to see them.
Okay, responding to Govi's education, only primary education, this is noted, and we visit Govi and have a discussion with them, and we see how we can support for education to go above primary education, because I don't think that is the best thing for people with disability. It should go beyond that.
Yeah, thank you.
Okay, and the computers, these are not drills, they're different from the drills. You know, the drills are, they only touch with their fingertips and they move on. But with the computer, these are, I'm talking computers. Yeah, if you press a letter, it will voice the letter. So you know exactly what you are doing. When you type a whole word, it will there will be a voice to call the word. So you know exactly what you are doing. Yeah, I think this is what is recommended now. That's why we are going on for those ones. And we are buying a limited number this year for a start. And we will see how it goes. Based on lessons learned, and we will scale up. But our intention is to provide all the tertiary institutions with these talking laptops. Yes. As to buildings, yes, public buildings now is recommended that each public building will have facility for people with disability. 2 years ago, I was at the Paraguay campus with the Minister of Higher Education to see for myself what was happening there, just to make sure that people with disability, their needs are taken on board. And my recommendation in some buildings have easy access, but some have challenges. But then I made a recommendation, and the minister told me that they take them into consideration. So I was recommending for lifts, for each building to have a lift. Well, unfortunately, that wasn't part of the design. But at least we are able to make sure that they have the ramps all over. There were a limited number of ramps, and I recommended that they have more ramps. And then the issue of the lift, there's really what they can do. It was really the initial design. That's the challenge. For them to see what they can do. Because just like anybody else can move around the campus, up and down the buildings. I feel people with disability to also have the same opportunity to move around the campus, up and down the buildings, and make use of facilities as required. But we'll follow up on that. The beggars, okay, beggars with disability. Yes. And if you look around, there are a lot of beggars, but there are very few with disability. There are a lot of beggars, but there are very few with disability. And I would listen to say that if you look, if you discuss with the beggars, most of them are not Gambians. But that doesn't mean that you should support them. But I just want to be clear that most of them are not Gambians. There was a survey which said the majority are Mandingo. Sadly, those who did the enumeration didn't understand Mandingo. They understand the different dialects. But when they speak, you know that, yes, these are Mandingo, but they're not from the Gambia. That's the difference. So that's why when you're doing surveys, you should be sure that we have enumerators who are conversant in the different languages. But this doesn't mean that you should support them. They're going to support them. And the 505 has been captured in the social register. Some are from the beggars that are in the streets, but some are in the homes. And I have mentioned that we are supporting 505 people with disabilities through cash transfers. Some of them are beggars, but some live in the homes and they don't go out. Yeah. And we're trying to educate the families. People, yes, having a disability doesn't mean that you cannot do, it's an inability. Yeah, we are trying to sensitize the families and the communities so that they allow them, one, to go to school. They allow them to take part in social activities. They are not discriminated against. They should be recognized and given the full respect because they are human beings. Yes. And these are ongoing activities, but you have to understand. We continue with what we live. Yes, so we have to continue with sensitization and awareness creation so that they don't allow them on the home, but allow them to go to school and also take part in other social activities. Yes, the ones in the schools. Okay, yes, you said the ones in the school are the ones we are supporting. What about the ones in the streets? As I mentioned earlier, let the families expose them, let them bring them out first. Yeah, once they are out, then it will be easier to be able to support them. Because we want to work through formal institutions. Yes, we know work with them through the streets, but that's going to be very difficult. Because we will be able to monitor their progress, and it will be difficult, it cannot be sustained. But once they're within an institution, it's easier to give support. Institutions can be schools of learning or homes. Yeah, the council, we establish the council, you also know, and we give them support financially because they come up with their work plans and they implement the activities across the country. The PhD here, together with the director, director, I'm sure they also have something to say about what we are going to do with the now, all of them are also here. I'm sure they also can say something about what we are going to do with the
Thank you very much. I just wanted to guidance on the establishment of the Disability Council. It's true that the Act was enacted in 2021, but we started receiving funds from government only in 2024, and it was the first funds that we received, a total of $4 million.
You only started receiving funding 2024
from government.
For the council?
For the council, yes. So when we received that enforcement, I decided the ministry and decided in last week on where to spend it. Because the council is in existence, we allow the council to make the request. So it's based on their request, because 4 million might look like a big amount, but it's not a big amount. So based on the request, we realized that since these funds are limited, we have to do prioritization. And again, we invited the chairperson of the council prioritization. So we went back and forth until we were able to have a consensus or where to spend the funds. So all the activities that we are funded, they are based on the request made by the council. Because what we do, we encourage all the OPDs to pass through the council. We don't encourage individual requests. So they pass through the council because that's a more organized way. Because the council is also equally responsible for monitoring the funds, how the funds are. So 2024, we have disbursed the whole 4 million. So now they do it, they give the monitoring. So we expect them to give us at least a report of how the funds were spent, so that we can reconcile for 2025. Again, for this year, we have also another 4 million to disburse. Again, we'll ask the council to make a request in that regard so that we can do the disbursement. So I just wanted to make that clear, that funds only started coming in 2020.
One thing also, because the council's objective is they are the ones that should promote the implementation.
Exactly.
So they must have funds to be able to, and they have to do it in all 7, or I mean, in all the regions in this country.
Yeah,
because that is their mandatory obligation according to the law. So we make sure that we will have that in mind when we do the budget That's why we have to do this now, so that we work towards the end of the year to ensure that they are quite equipped, because persons with disabilities also need to be factored in this budget. And if an advisory council is mandated to promote the implementation and to provide opportunities for persons with disabilities, because it says here, and the equalization of opportunities. So they should be doing some of the things that your ministry is already doing, and you might be overburdened. So I think we need to work together to ensure that these things.
Even there are a lot of support and advice. In-house, ask them to, you have to be more organized and to structure themselves. I think one of the reasons why the disbursement was late from our end is because they didn't have an account.
Okay.
Because I remember telling the chairperson, how can you be established and then you don't have an account? Where do you expect us to get there?
So
transfer the money that
they have an account now.
So they actually have a lot of the organization.
Organization.
Hopefully this year will be a better year.
We will also.
That is why I wanted to ask, since 2021, does it mean that you people have not been requesting that fund, but you have to inform us that you did not have an account before?
No. Let me there.
Yeah, okay.
The funds were allocated by National Assembly.
Okay.
Yes, if you look at page 17, sources of funding for the country. It says
Monies to be appropriated by the National Assembly.
Okay.
Donations. So you've only been working on donations and gifts.
Exactly.
Yeah.
And that wasn't
Okay,
adequate.
it wasn't
So
adequate.
the council was established in November 2023. It's funding for VNFP. Then if you look at page 15,
You want to join us today?
Gender.
It's only gender.
It's gender.
That's why I'm so proud.
Come and join us.
No,
You are
I
welcome.
it was only in
I'm
November.
not joining today. I'm joining.
No.
It's after they established in 2020.
Okay, ma'am.
When they established in 2023, then they developed a work plan which is submitted to us. So if you look at page 15 of the act, it says that clearly functions of the council.
Yeah.
One is to act as national advisory body to the ministry through which the needs, problems, concerns, potentials, and abilities of persons with disabilities can be discussed and communicated to the government as its agencies for action. The other one is advise the minister on matters related to care and maintenance of persons with disabilities. Participate in the monitoring of all facilities and programs designed to serve persons with disabilities and advise accordingly. Advocate for the promotion of and encouragement of activities undertaken by institutions, organizations, and individuals for the promotion and development of programs and projects designed to improve the lives and situations of persons with disabilities. So based on this mandate, they developed a work plan, which was submitted to us. But as PS was trying to explain, there was a background and forward because we have to make sure that it was in line, it was properly done, before everything was finalized. And then they didn't have like a bank account. And the way government money moves from one bank account to the other. Yeah, so by the time that was done, it took some time. But eventually, when everything was done on time, they were able to start implementing their activities. And they will monitor, because our staff bears them in the field. We have regional staff who are closely with them at all levels. And if you start at national level, sometimes bear them in the field for implementation of their activities. So now it's left for them to do their report, based on which they have another work plan for allocation of funds for them to implement their activities. It's only for them, like, it's not much. If you think it's not money.
It is not. It's not much. If you look at, that's where the data comes in, because to be able to allocate adequately, you need to know how many people. Because you are saying that you've allocated certain amount for different regions. We need to know, because disability might vary in different regions. So we need to know. Also, we would want you to give us the data, like the number of people with disabilities in each region, so that we will know if the allocation in each region is also adequate. That's where data also is very important in this, so that we will know. Because if we say that 50% of the population are disabled, but in each region, how many? We recently had a census, and I think that they might have that data as well. So we will need to know. We are going to also meet, because the law says that the money should be appropriated by the National Assembly, also by donors, grants, and gifts. And if we know your activities, if we know the needs also, we can talk to the donors to also try to complement some of the activities that these people do, because whatever we do should be for the interest of the of the citizens of this country, especially those that are most vulnerable. And these disabled people are the ones that are most vulnerable in society, because some of them are even forgotten. And there is an obligation for people that owe these people duty of care to report and to make sure that they are not discriminated against. How does the ministry do that monitoring to ensure that people with disabilities are being taken care of, especially by parents? We know that some people with disability are treated as rap, and they are maltreated at home, and they are locked sometimes. It's very difficult because it's the society. How do we support you in making sure that those people are also sent to school? Because some disabilities can be more advanced if you are treated somehow. I mean, we have people in the West that are severely disabled, but they can live independently eventually with some support. How do you think this committee can support you in identifying those people?
Okay, first of all, let me respond to the question on data. We're getting data from the social register. And the support we are giving, the cash transfers, are those with multiple disability. Multiple disability. But then when we study, there are other people who have mild disability. But disability is a disability.
Yeah.
That's so what we are going to do from the data, we'll extract all the people with disability from the data. And then we categorize the nature of the disability. So that we can get the population of people with disability. That's what we want. And then based on that, we try to identify their needs. Together, we're going to work with the Disability Council. Once we get the data, in the population, then we try to find out what their needs are. And then based on their needs, then we can come up with a work plan for implementation to address their needs. But I have no doubt that it's going to be a line number. Because those with multiple disabilities are 505 across the country. And if you look at all the disabilities in total, I'm sure it's going to be a large number. But then it has to come out. And then what we have, then we can then verify activities together with the Council of Atlantic Council and be able to see how much we will need annually to address their needs. I'm sure we can get all the money, but whatever we have from the National Assembly and also from partners and donors, we'll work hard to see how we can address their needs. Yes, you mentioned people with disabilities stay in homes. I mentioned that earlier. We are sensitizing communities and families to bring out people with disabilities. They shouldn't keep them in homes. They shouldn't discriminate against them. They can go to school and learn a trade. And disability doesn't mean that you are unable. Disability is not an inability. So we have to do more sensitization at community level so that they bring them out, send them to school, and make sure that their rights, their needs are met. And until families bring them out, it will be difficult for us to go and give them support. But then, that notwithstanding, we know it's a big challenge. Some people don't want to bring out their children with disabilities. But we have to go out and more and find out where they are and then be able to see the nature of the disability and come up with a solution or a program to address their needs. Yes, you have a point there. We have to do more of sensitization and awareness creation so that they can come out for us to know where they are and the nature of the disability and be able to support them accordingly.
Because it is mandatory that every child goes to at least basic school. But I think we also need to enforce this on children with disability as well, so that at least they can have some basic skills. And also the workplaces. How do we do monitoring and evaluation in workplaces, ensuring that they at least give people with disability the opportunity? Because if you look at the Western countries, when you have an application, they give an edge to people with disability. Is there any way that we employers give people with disability? Because I mean, in the Gambia, I think it's not only in the Gambia, I think it's an African thing. When you are disabled, you are just shunned. When you apply for a job, they don't even.
Well, in the Gambia, I think they are considered. We have magistrates with disability. We have magistrates with disability.
Okay.
It's not only one person.
Okay.
The chair of the council is a magistrate with disability. Yes. So they are not discriminated against as far as we are concerned. At our level, it's at community level where they keep them in homes and not send them to school. But I always said that in our own part, we are doing our own what we can to do sensitization and awareness creation so that they send them to school. And even before that one, I remember there was a disability in the course who was an interpreter. He had passed on. Yes, I remember. Yeah. But he used to be at the court and he used to do interpretation very, very, very well. I can't remember the name.
Cora.
Sorry? Yes, yes, yeah. So where people are aware, they send them to school and they excel. And if you all remember, when we were going to school, Kapama, they were teaching children with they used the braille. I remember that very well.
Remember, I know.
It's now that we are improving now from the braille where we put
To the
talking computers, which are more advanced. I think these all of us, not only us as ministers, but everybody in the Gambia, have a role to play in this. Let's create awareness at all levels so that people bring out their children with disability and send them to school.
Yep.
For the government, it is our responsibility to make sure that they acquire the high level of learning, because they should not be discriminated against. When it comes to jobs, we are seeing the offices, for many a time, some staff as interpreters, but then there are some who go beyond that. Yes, I think it all depends on the communities. Let's bring them out. Let them go to school and be educated. With the education, they can acquire skill and be able to contribute to national development as anybody else.
Yeah, you did mention earlier that you were training 22 people, so I really want to know what kind of training you normally.
Oh, okay, because I should very fast.
Yeah.
This is on the manufacturing of their limbs.
Okay.
We have a orthopedic unit here in Banjul behind the emphasis by the School of Nursing. Yeah, the School of Nursing and the pediatric hospital. We have the orthopedic unit where we train individuals on the manufacture of limbs.
Okay.
All of our staff is here.
Okay.
And 3 years ago, we got funding from Left for Africa and the Swiss. They got their trainers. We had already bought the equipment. We have the state-of-the-art equipment. And they came with their materials and we were able to manufacture limbs, train our staff on the manufacture of limbs. 11 of our staff and 11 from the physiotherapy unit of the Ministry of Health. Yeah, so they were all trained on the manufacture of limbs. And then the limbs are also fixed for individuals who have, for amputees who came forward at that time. And then, yeah, that was it. And then we continue with the training, and with the training that we have acquired, the staff have acquired, now they are manufacturing lighter limbs. Before, they used to manufacture very heavy limbs, because that was the material that they were using. You see an amputee with a leg on, but he or she is dragging the feet. But with the coming of the of Left for Africa and the Swiss, they came with lighter materials, which we are now using to manufacture the limbs. With the machine that we have in place, before it used to take 10 days to manufacture one limb. Now it is our 3 days to manufacture a limb. Yes. So those who are trained are our staff and the orthopedic units. We are trained on the manufacture of limbs.
I think we have gone, because I even had somebody send me something about the limbs, and I think we are doing a great thing. She sent me a photo. She had her foot amputated, and I think they even, but it's in Buyam.
The team also go to the
The team was there.
In Buyam,
Yeah.
in Buyam, and I think when she sent it to me, I was quite, because we have gone a long way, because before, you wouldn't have somebody, and they were teaching her how to walk with the limb. But then it was very difficult for her to go all the way to Buyam, and she's a very young girl, and I really felt for her, so I said, let her just continue, we'll be paying for her to go, and now she walks around with it, and I think it's a good thing that the ministry has done, giving them the opportunity to go and take care of their businesses, because she's only about 26. Unfortunately, she's very young. She's very young. It's like, it's really...
Yeah, what I'm telling you now is to get the material. You remember the hotel that was used to train our people and the operating unit? It's very light. I remember the graduation. I saw women dancing with the legs on.
Yeah.
So you know that they had it's not an original leg.
Yeah.
And then also, see, the footballers also, the amputees, we have an amputees football association. Yeah. That's material that they use to manufacture their legs that they are using, you see. So now our challenge is to get more of those materials. That's our challenge. Yeah, the challenge is material is expensive, but it's not available in the Gambia.
In the Gambia.
You can only buy it for Switzerland, Spain, yes. Our staff have been trained to manufacture those limbs, but we need material from Switzerland and those from Spain. They are very, very light. With those materials, you can manufacture light limbs, and they can walk around freely like anybody else. They can perform, take part in sports. And the ladies are she does really gardening. But with the limb now, she's very free to move around her farm and work on the meeting regarding.
And they also train them on how to go back to normal. I was quite impressed
Sure,
actually.
they play football. So if they can play football, then they can do anything else. Yeah.
Thank you, Honorable, for giving me the floor. Just in addition to what the Minister said about Matthias, the rehab center itself, we have also Ministry have constituted a task force to look at, how to make that center a center of excellence, where those people from the sub-region will also come and then learn how to manufacture these artificial limbs. Already with Legs for Africa now stand, they have also hired someone, a consultant, who's going to work with us closely to make sure that the program for that unit, how to develop it, and so it will attract people from the sub-region and beyond to come and learn some of this, how to do it. Because Gambia is served as within the sub-region is one of the best. So the staff we have at that unit definitely are trying, because some of them, if we went to Tanzania, to go and learn how to do the production of the artificial limbs, and they are back now. So we need support of the National Assembly, as the Honorable Minister said, because some of these things is very expensive. So with this support, we want to do more, and then within the country, we also will have a rehab center, whereby because some of these people coming to the greater Banjul area, they don't have relatives around. But if we have these centers across the country, it will also help them to go a far distance to access the service of that nature. So we definitely need your support. And on the advisory council, they also established regional committees in each of the regions that will take care of the welfare related to persons with disability. Because at the national level, yes, we have them, but the regional level too is also, there's a need to have one. So they did all those things last year. Each region has a committee, advisory council that will advise the local government and the governors in those regions. And they will work closely with our social welfare officers in the region, so that issues of persons with disability, they will be able to adhere them. So at times, when we have issues reported to us, those families that are not taking their children with disability to school, if we receive those information, we act on that, and we visit those families, try to enlighten them that it's the right of those children to also have access to education. So that is a continuing process. We will continue to do. Thank you.
Yeah, he's talking about the regional center that I mentioned earlier. Yeah, Legs for Africa sent a consultant to see what we I think it was his third time for Gambia. It was his third time for Gambia. And Gambia has been recognized as the most appropriate country where this regional center for training can be established. So very soon, I'm sure, the work will start so that we get the right infrastructure in place, and then we can start doing the training of countries in the sub-region on manufacturing of limbs. But then we also need support for the National Assembly, so that we have more money to train to manufacture limbs for our own people. I mentioned that the equipment that we use, the material is very important. What we have been using was a very heavy material, and when it is the limbs are manufactured and they were fixed for individuals, they drag their feet. But with this light material, you don't see them dancing and playing football. I think that's the best thing for everybody. So this is the reason why we need more support from the National Assembly to get more money allocated to us, so we can buy this light material to be able to manufacture the limbs which are lighter and more user-friendly to people with disability. Yeah.
And also, how is I'm still on the monitoring and evaluation, because that is how we know whether implementation is being done. Because if you look at clause 16, it says village, ward, area council, and regional and district. Page 17. There should be committee in every village, every ward, every district, every area council, region, municipality, or city council. Because once we are done, the committee's work this period would be to make sure that everybody knows about this Disability Act, be it the ministry, be it the wards, be it the councils, and even individuals living in their own homes. We are trying to work with UNICEF to ensure that everybody knows about this, because it's been 3 years and it also helps you, because when we do the budgeting, we need to know in each region what to add. Are these being implemented in these areas, or you are not aware, you are not sure?
Partially. In his intervention, he made mention that we have a council at national level, and also at regional levels.
Okay, national and regional.
Yeah,
Okay, then we will work with we will work with the regional, because from meeting with you, we are also going to meet the regional councils to make sure that they also play their part, because they are specifically mentioned in the act. So they also need to support the central government to make sure that what you trickle down also they also play their part, because you shouldn't be carrying all the burden when the bills distributes the duty of care to all of them.
We have a national about the council and the regional ones. And this is the reason why when they are implementing the activities, the radio station focus only on one area, but they also put the regions to implement their activities. You take note of the fact that there should be village, ward, and district committees, and then we'll work with the National Advisory Council to make sure that we filter down their work at grassroots level. We shouldn't stop at only the regional level, but we should exceed that toward district and also village level. Take note of that, and then we'll advise them accordingly.
Thank you so much. Have we left out anything? And you've also just recently presented your report at the CRC. What were the recommendations on people with disabilities, children especially, and elderly with disabilities?
Thank you very much. We've done our report, presented it, and we applauded as having one of the best reports. Then we are very small, but I think wherever we go internationally or globally, we make impact. And I think that's because of the commitment and the leadership that we have in country. And some of the things that came out were in connection with people with disabilities and also gender. But then it's clear that for us, there's no gender discrimination. And we don't discriminate against people with disability. And we made mention of what that we are doing in terms of the cash transfer, and also in terms of providing the necessary equipment and materials for people with disability. And this was quite applauded. Yes, no report goes without challenges. We have made them understand that where there are challenges, we've noted them and make sure that they are addressed before the next reporting cycle.
Their recommendations were they welcome the Persons with Disabilities Act, but there's also what we've also mentioned the data here, and I think they also picked that up. But they also mentioned disabilities with children with albinism, especially.
Yes.
So what are we going to do to ensure that those people are also factored in everything we do? Because sometimes they are forgotten, and sometimes they are kept at home because they don't have the opportunity to go out, because obviously they will need glasses, they will need sunscreen, and they will need all that. So, and if their parents cannot afford that, they cannot come out. So what are we going to do? And that is specially mentioned that we need to do something about that.
So for them, that is really urgent. From the disability fund, to be sure that we address all of those concerns. First of all, I keep mentioning that we have to do desensitization. Awareness creation. Let's promise that these people have an ability. Disability doesn't mean an inability. Let them bring them out. Once that is done, and we know what their concerns are, we can address them through the disability fund. It's probably yes, it's a lot of money, but then you can with everything. But we have to prioritize. And this is a rule that we can prioritize and make sure that those with albinism, they get their glasses, they get their sun, the lotions and whatever they require, so that they are not left out.
And also their parents, strengthening parental support. That's also very, very important.
Yeah, for the parents, one thing we can do, we can support them through the cash transfer. And then if they are able to form an association or a group, we can support the group in enterprise fund. Yes, so they're doing support the parents through the cash transfer, and also asking them to form a group, and then support them to do more enterprise fund and take them on entrepreneurship.
I just want to add that if you look at the Women Enterprise Fund Act, it also makes provision for the inclusion of persons with disabilities on the board. So this year we've written and we've got a nominee, a female nominee to be part
of the board.
So her presence on the board will also be very
Very
in
important.
terms of identifying the needy groups.
I think those small and poor, I think we are ahead of
Yeah.
many countries, and I think that should be, it's one step at a time, but I think we are in the right direction. Because having read the concluding recommendations, one would feel proud that at least, even though they pick certain things, there are many good things that were also mentioned, and I think we don't just look at the negative, we look at where we have done right as well to try to see how we've done it and improve on the others. But overall, I think we are not doing bad.
far better than most countries. That's why I said, do small, but where we can impact.
Yeah.
It's not 100%, but we also accept our challenges and promise them that we look to lose as well.
You will know, you'll come to realize during COVID that I think we are, I would say, better than even some Western countries. Because if you see the deprivation during COVID, even in the Western countries, I think we were a lot better. Because we saw that some of our children were learning through radios, while some of them were totally excluded.
That's right,
Yeah, I think we should also appreciate the little things that we also do right.
I think it is because as a country, when there's an issue or a problem, we come up with innovative ideas to address the issues. I think that's where we are ahead of most countries.
So if there is no other thing on the Disability Act, if there's any other contribution, but I think we've exhausted our observations on it. We will go and meet with other stakeholders. Of course, we will also want to meet with the Advisory Council, and we will eventually have a tour across the country to also sensitize communities on this act, and also local governments and councils, area councils, because they also have an obligation on it. If there is no other contribution on agenda item number 2, we proceed on agenda item number 3.
Before you move to agenda item, what I want to see is that at your level, National Assembly, if you appropriate, you are allocate to us a lot of funding.
We will.
Yes, because it's not easy to get, now there's no fatigue. It's not easy to get funding from donors. But I know whatever we have in the Gambia, in the pockets, in the baskets,
Baskets.
make sure that at least give us some more money so we are able to address some of these concerns.
We will definitely consider that. And I think that they have also, we really worked hard during our bilaterals to make sure that money was added, because it is a ministry that caters for more than half of the population. So it needs to reflect on the budget as well. I think we will do our best, and whenever anything comes, we'll make sure that we put in our best. But also, if you need anything, come to us also, and we will push at the Ministry of Finance level to make sure that they support you, because we've seen how passionate the ministry is and how you struggle with the little that you are given, and always in the right direction. So we applaud the ministry's work and the openness of the ministry as well. Thank you. So
Thank you very much.
we move to agenda item number 3. Like I said, it is for your information, because we will need your support in this. We are hoping that other bills that the government would bring, if at assembly level it goes through, then we would not need to do this, but we will also factor some provisions of this bill, because obviously we are a committee, we are mandated by the assembly to make sure that gender equality, women empowerment, and if you look at your CRC report as well, it factors on representation and how to improve on women representation. And that's why as a committee we came up with a constitution amendment bill for specific reserved seats for women, especially at the national level. So it is for your information. If you can support us in this, if you have any additions that you think that can be added, it will be most welcome. But when we do our consultation with stakeholders, we expect you to be our main stakeholders, because you are the ministry in charge. And if you think that you want to table, because there are many bills that come from civil society, even from National Assembly, and if the ministry in charge thinks that they can do it for us, we are very willing to do all the work and hand it over to you if you want to table it, and it will be, instead of being a committee bill, it might be a bill from the government, but it is up to you. But this is a bill that the committee has come up with, and we are working on it, and we will need your support. We all know that the Constitution gives us all the rights, equal rights in this country, but notwithstanding, being a patriarchal society, we have some limitations. Women have some limitations, and it is recognized. I mean, the number of women in the parliament speaks volumes. The number of women at cabinet also is a concern, because I don't know, we have about 20-something ministries, and we only have 3 women. We have 58 members of parliament, we only have 5 women, and 2, thanks to the president, nominated 2. So if you look at the bill, even the nomination members are mentioned, that if the president nominates 5, at least 2 should be a woman. And we've also did not forget about the people that are disabled, physically challenged people. We've also allocated like 2 for the physically challenged, one of which should be a woman. So this is for your information, and we solicit your support. It is at committee level now. It has not gone public. You are the first people that we are sharing it with, because we think that you are the... And also we also have the Charter for Children, for the rights of women and girls, and women and girls with disabilities in the Gambia. Also, we are thinking of tabling this. The reason we withheld this was to await for the recommending conclusions of your CRC report, to see whether we can reflect that. Because if there's any need, we can reflect it in our report. And if it is adopted by the National Assembly, then it will make sure that the government gives you that support to also make sure that when you do your next report, if you look at this report, if you think that anything is left, I mean, you are most welcome to contribute to improving this, because it is directly under your ministry. And we solicit your support. And when we table it, we will invite you to come and witness the event at the National Assembly and give us your support and your blessings. Thank you very much.
Okay, thank you very much. First of all, I want to talk on the Charter for the Rights of Women and Girls with disabilities in the Gambia. Okay, we look at it.
Yes.
In-house, and if you have any comments, we will let you know.
Yes, please.
Of course, we have no doubt, we must support this. It's what we want it. Yes, but we look at the content first.
Yes, please,
and then,
yeah.
And then come back to you with our feedback.
Yes.
And then we move from there.
Thank you.
That we support it.
Yes, we are.
Look at the content first.
We are open for, if you have, because we are all human, if you have anything, this is directly under your purview, and you are the experts. We are only, like I always say, elected people are not always the most, the best in the society. They just happen to be elected. But you are the experts in this. So you can also guide us. If you think that we have left anything, or if you think that we have put anything that is wrong, I mean, we are open.
That's why I said that we look
in-house, yeah.
if you can share with me, it's soft copy.
Soft copy, okay. Yes, we will share the soft copy.
Yeah, we got documents that here,
Yeah.
and I share with you accordingly. Yeah, but I know that we are going to support this.
Thank you so much. Thank you.
Okay, on the Constitutional Amendment Bill, yes, of course, we are always discussing this in the House. That's true. National Assembly.
National Assembly.
Yes.
I think it's
a letter, and they are doing a cross-step note. And when we go to New York, we follow up with the Peace Building Fund Secretariat, where we have a Gambian,
Adam, the former Vice President, yeah. She was my classmate.
An extension based on lessons learned. Because for me, I think those women that have won have been faced several times, and now they've acquired skills. Skills in negotiation, they are more assertive, and they can stand up on a podium and express their views. And so I think that's a plus for us as the Gambia.
The Gambia,
so
yeah.
because of the continuation of the project, preparing, of course, for the National Assembly.
And that's
and we must have only the women themselves, but also the political parties. They support women.
Yeah.
Women candidature.
Yes,
yeah. Exactly. And then rally behind them so that they can win the elections. And also the young community. Let them know that when women are there on top, they can make it. They can make a big change for the benefit of the nation. So it's going to be another project for a continuation, and we're hopeful that we get it developed and funded so that will continue. And that notwithstanding, this is also very important. It has to be in the Constitution.
Yeah.
It's also very important.
Yeah.
Yeah, we go to it and we will give you support.
Support. Thank you so much. And also that's why we are working with your ministry also to be present at the CSW to also bring our case so that obviously we can have the support of the UN. We are working with them at national level.
Well, they will support. They will support. Yeah. Because we present to them our achievements.
I think it will be,
justification for more support for the continuation. Yeah.
and the timing also of the bill is very important because we need to do it this year so that at least it will give the IEC the opportunity to be prepared because it takes effect in the election in 2027 so that everyone on the ground will be prepared for it. Because otherwise people would think that it is for political parties and then misinformation will be widespread.
Without that, we expect that misinformation.
Thank you so much.
To interpret it differently.
So we go through it as well.
And then we can also have another meeting on this if after you have looked into it, and then we'll see how to present it. Meanwhile, it is termed as a committee bill, but things can change depending on how things go.
Yeah, we look at both, and the one on the rights of women and also the constitutional amendment.
Yeah.
Okay. We look at both, and we let you know when we can meet again, so that we can look at it together.
Okay.
Yes.
Thank you so much.
I say public here, people need to be sensitized about this. I say that we have somebody to sponsor, you have to be able to sponsor us. Inside. No, inside. To sensitize them. Yeah. It is. I think people to minister subscribe money.
Okay, thank you very much. I think if there's no any other matter that both the MPs and the ministry would want to, I think we can release the ministry. And thank you again, Honorable Minister, for giving us the time. Thank you so much. It's really appreciated. Thank you.